All right. Hello, everybody. Welcome to another episode of Mind Matters, Navigating Head Injuries and Concussions. I am Kylie Como with Shane Smith Law, and today we're talking with Dr. Reis with the Neuro Connection. Hey, Dr. Reis, why don't you just introduce yourself? Tell us a little bit about you.
Yeah, happy to. Thanks for that, Kylie. Once again, my name is Dr. Erik Reis. I'm a chiropractic functional neurologist at the Neuro Connection. We are a specialized neuroorthopedic clinic in Edina, Minnesota. And I've spent the last decade of my career working with complex neuro cases. So yes, that's concussions. Yes, that's post-auto whiplash, an array of brain injuries, dealing with chronic headaches, migraines, and dizziness. And the reason I really got started in this space is because I was a patient first, I became a doctor second, and now I'm just a massive advocate third. And I think because of that journey that I've taken, understanding what it's like to be in a patient's shoes, being on the opposite side as a provider, I feel like it's given me a very different lens of what we can actually do to help people who've been stricken with this unfortunate thing. Very grateful to be here and looking forward to this.
That's impressive. I did not know that about you, so I'm sure we'll dig into that piece of it a little bit later. And the insight you're about to give is going to really highlight, kind of how you came to that, not just through your medical knowledge and expertise that you gathered through school and your practice, but because you've lived it. The Neural Connection. That's a cool name. I like that. It's a little play on words. So tell us what makes the Neural Connection unique.
Yeah, outside of us really spending a lot of time on trying to understand this space, I think there are a couple parts that are really important for us that we've really brought to the surface for what we think makes us different, right? So I'll never say that I'm the only provider that could ever fix somebody, right? I will never say that we're the best. I think that those words are quite grandiose. I think what we do is we are always focusing and trying to take a different approach to care. We are keenly focused on three major areas. The first one is looking at people structurally. And I don't think that that's surprising for anybody who's had a concussion or a brain injury or been involved in an auto accident. There are inherently structural things that will occur as a result of an injury like that. And some might be small, some might be medium-sized, and some might be quite severe and potentially catastrophic. So the structural component is something that will never go away anytime soon, and that's really important for us to understand. The second piece to it is really the neurological side of things. And I think so many people, when they think about the brain, they think of this elusive, enigmatic kind of thing that we all occupy and possess, but it's quite complex. But there are a lot of things that we can really look at to understand the integrity of the brain. Things that you and I, Kylie, might take for granted until we lose it. Maybe it's walking into a big box store and, being like, wow, why are these lights so bright? Or, I feel anxious in front of all of these moving people. Maybe it's as simply as going from something like seated to standing and feeling like you get a little lightheaded or your blood pressure skyrockets. Or maybe it doesn't. Maybe your heart rate elevates and your blood pressure drops. Basic things that the brain should control and does control. And things that we know after a concussion or a brain injury can be affected in some way, shape, or form. So the neuro side of things is a really important aspect to that. The third one's really nutrition, right? So it's diet, it's, looking at your nutrient panel, your metabolic capacity. I'll tell you this, the brain that you have going into an injury and the metabolic capacity that you have going into an injury will indirectly and directly affect the outcomes that you have afterwards. So, I have patients who've had genetic predispositions for underlying autoimmune conditions where they didn't express that prior to the injury, and all of a sudden they have this massive traumatic effect, and all of a sudden now their immune system's out of whack. Having even things like dysglycemia or like diabetes can have a big factor because we know blood sugars are quite reactive and quite pro-inflammatory. And so if you don't have those under control, then the brain, as it has an inflammatory cascade, can also be affected by that. So on top of that too, the structural, neurological, and the nutritional, I think one of the really essential pieces for that too is the emotional and the personal side of things. I spend 90 minutes with a new patient when I have an examination. And it's not because I want to, it's genuinely because I feel like I have to. I need to understand the person that's in front of me. And you are not your diagnosis. You are not just your symptoms. You are a human who has family and goals and aspirations and things you enjoy. And so we're really keenly focused on trying to bring that back into medicine. Most doctors only get 8, 10, maximum 15 minutes for a patient. I really want to set a standard of building that trust back between doctors and patients. And that's a really key part.
That's impressive. I caught that fourth, the emotional, right? The personal. That's such a big part of, healthcare that I think doesn't get highlighted very often. Man, what a key piece that has to be there. And so thank you for highlighting that. What struck me as I was reading through the Neural Connections website was I kept seeing, compassion, sympathizing, empathizing, and you kind of touched on that some of there. So, I'd like for you to dig into, how that works. Have you seen practical outcomes that show the benefits of that?
Really, it comes down to human behavior and psychology, right? So, there's a reason that every high-level study has a double-blind, placebo-controlled variant. The power of belief, the power of understanding, the power of connection is a very primitive thing that we all possess. And it's so important for patient care. And I really feel as though we have lost our way on that path of listening to patients. And, we've been taught in school when you go practice medicine, 80% of your diagnosis is in your history. Well, what happens in the history? Patients are giving you the tale, their internal effects, their emotions, their feelings. And that's a really important aspect that unfortunately a lot of providers don't always spend a lot of time listening to or digesting. And so I think that that's key. Where that's really manifested for us from a clinical standpoint is my goal is to always get patients to be able to be self-sustaining. Now, sometimes that may not be realistic depending on the severity of their injuries, but what I'm going to tell you is that there's something to be said about empowering patients to be able to own any and all aspects of their health, right? And when you do, people become motivated, they become excited, they start to realize that they're not stuck, they're not broken, they're not a lost cause, that there are ways to potentially get them to live a higher quality of life. Now, I think saying that you can cure somebody or you can fix somebody is a very strong statement, and I don't necessarily agree with that. But can you get somebody to live a higher quality of life and optimize their ability to do the things they want to do? I absolutely, truly do believe that, regardless of what has happened to you in the past. But where that's important is understanding that there has to be that trust and there has to be that empowerment for patients to realize that health really occurs outside of the clinic. I want you to get better inside the office. I hope that my treatments are improving, but I really need you to engage in that as well with the therapy, the rehab, the dietary changes, the sleep modifications. I mean, basic things like that have massive gains and outcomes. And so it's kind of the equivalent of like, you can give a man a fish, but teaching the man to fish kind of feeds him for a lifetime. I think it's kind of the same analogy we're trying to do with the clinic is we want people to feel better being in our office and getting better with treatment. But my goal is to lovingly, respectfully kick people out of my office at some point and get them living their life to the fullest. I really feel that that's what healthcare should be.
Yeah, sort of that working oneself out of a job, so to speak, right? Patient by patient.
Exactly.
I think you expanded on some important pieces of, just you said the words, that belief, somebody to believe in me, that buy-in that you're going to get from a patient when you feel that, you said the word trust in there, because it sounds like there's a lot of work to be done when you're recovering from a brain injury, right? Much like the body is injured, you're going to have to do physical therapy for an injured arm, shoulder, back. The brain's no different, correct? Exactly. I did see a lot of your patients talk about rehabbing the brain. What does that mean? What does that look like?
The way that we develop as humans, we are essentially always trying to navigate and figure out how to move in our environment. That's a really important piece to that. There's a reason that we base development for children off of neurodevelopmental and motor milestones. Human movement is an essential piece to humanity. And lo and behold, physical exercise is one of the greatest ways to stimulate and activate the brain. It really does light it up like a Christmas tree. And so physical movement is part of that rehabilitation, right? So it's not just saying, oh, we want to get you to go lift weights. It's understanding that your ability to navigate the world and balance and activate muscles and stimulate different movements is a really core part of being a human. And so that's where the structural and that rehabilitative piece comes in. The brain's involved in all of that, right? So go have a conversation with a cadaver that has all the muscles, all the joints, all the tissues, and all the organs, and you are not going to get very far, all right? Because the brain controls everything. And it's beautiful because what that means is that when you understand the brain, it kind of gives you a bit of a roadmap or an opportunity to potentially look at these avenues. So, brain rehabilitation can look like an array of things. It could look like structural care, like I mentioned. It could look like visual rehabilitation, which is a massive part of brain rehabilitation and concussions, really well established. Neuropsychologists have known about the eyes and vision for decades. And it's not just seeing clearly, it's being able to keep your eyes parked on a target. It's being able to track that target with your eyes. It's being able to judge depth and distance, making fast eye movements. utilizing movements around you to be able to understand whether you're moving or not. And so that's a big piece of it. Vestibular or inner ear components, which essentially are aspects where you, it's like driving in a car and closing your eyes, right? You know you're moving in some way, shape, or form. These are really important aspects to, the brain function. And once again, there's the emotional side of things. With all of that being said, your brain is kind of built like a house. And the first thing you do if you built a brand new house is you build a really stable foundation and put things down there that you didn't really need to think about, but you need. So that's like plumbing, heating, electricity, and sewage for a normal home. The brain's kind of wired the same way, where you have things in the lower part of the brain that do things that you shouldn't have to think about. So Kylie, right now, you shouldn't have to think about balancing your blood sugar or regulating your heart rate or optimizing your digestion, but something neurologically is tackling that. And so as we start stacking these layers on top of each other in the brain, we all metaphorically live in this third story of the house called the VIP suite, where we have thoughts and beliefs and cognitive processing. What happens with a concussion is you essentially have this rattling of the house. And what happens a lot of times is you can have a relatively uncertain outcome. In most cases, you have a really unstable foundation that occurs. And so it doesn't necessarily matter what you do to the upstairs. What happens is you actually have to allocate resources to go address those aspects downstairs. We see a ton of patients who have issues with just cerebral blood flow. Dysautonomia is the clinical term, where blood flow is being altered, or, gut function is now being affected. Your heart rate and your digestion and your ability to balance your blood pressure out and have an appropriate response can be affected. And so neuro rehab can look like a lot of things. It can also not be a lot of things, right? So it really just depends on the person and what they need and what they're presenting in front of you. Anything and everything is fair game in my book. I do things that PTs do, that OTs do, that cognitive behavioral scientists do. It just depends on what's going on. And that's why I get excited about referring patients out and co-managing care. Is I don't want to do all of that. I like to stick in my lane, but patients can need anything and everything. And that's my job, is to figure out what that looks like and make sure they get the care that they need.
Wow, that is amazing. That's got me excited to know that there's a resource out there like you and your practice. It's tough work. If anybody out there that's listening or watching this and has had to go through any kind of physical rehab knows that can be tough. Would you say that sort of rehabilitation is also part of neural rehabilitation, the physical movement part? But you mentioned a lot of other components and modalities that somebody may have to go through to rehab their brain. Would you say that rehabilitating from a concussion is as difficult as maybe rehabilitating from a back injury, or maybe even more difficult?
Oh man, I'm sure people are gonna roast me in the comments based on this, but here's what I would say. Okay, my lane is concussions and treating in complex neuro cases, right? So I don't work with a lot of low back patients. I rarely see them, to be fair. I've only spent time in the neuro space, so I'm a bit biased, right? Here's what I would say. I have colleagues who treat low back pain, and those cases can be quite intense and be quite complex. Yeah. Because you are not only dealing with mechanical and tissue issues, you're dealing with underlying metabolic issues as well. If you're more inflamed, you're going to just unfortunately have more inflammatory mediators that could actually be affecting disc issues, low back issues, things like that. But you have to remember that this whole biopsychosocial model with pain is a really important aspect too. So you can have mechanical issues, you can have structural issues, you can have inflammatory issues, you can have just cognitive or emotional outcomes as well that influence pain and your relationship with it. So treating concussions, to me, yes, they're complex. I don't think anyone would argue that. I think I would be shooting myself in the foot to say that those are more complex than low back pain or low back patients, because somebody who's got low back pain, they can tell you that their world has been kind of flipped upside down as well too. I think where things get interesting is where you start looking at the treatment options for concussions, right? So yes, it could be visual therapy. Yes, it could be cervicogenic or cervical therapies. Yes, it could be balance. Yes, it could be nutrition. Yes, it could be some of the cognitive, neuro-emotional stuff. And yes, it could be everything in between. From a standpoint that you are rattling the cage of the computer versus potentially looking at one smaller aspect of the computer. But I'd be hesitant to say that one is more difficult than the other, only because I know what clinical practice is like. And there's a reason we call it practice. We're always trying to figure out what works and what doesn't. So
well said. Very, very politically correct. I appreciate it. You're right. You're not wrong. You're not lying. Yeah, I would tend to fall on that side as well, having seen both physical and neurological injuries, and oftentimes those things happening at the same time. So yeah, it's a tough road, I think, period, and people need to kind of get their heads into that and be ready for a long road ahead. But again, having a partner, a cheerleader like you and your clinic behind them, sounds like they have a real shot at success. So I'm going to shift gears a little bit. There's something that interests me that I've got to know. I did pick up on something called what was it called? The 3 friends that go to the market.
Yeah.
What is that? What's that all about?
So it's a bit of a cheeky play, a way that we kind of help patients understand what happens with a concussion or a brain injury. Okay. So the story that I give patients, and this is just the analogy we've kind of come with, is if you had 3 friends that went to the same party or an event, market, whatever you want to call it, you would expect them to tell you relatively the same story about that event, right? So, who was there, what time it was at, where was the location? I'm always going to want to know, like, what kind of food was served, just because that's me, right? You would expect them to tell you the relatively same story about that event or party, right? You kind of have inputs and outputs and you're checking things. Well, the problem after a concussion or brain injury is you can have these 3 friends go to the same party or same event, and they can come back telling you completely different stories. So then who do you believe? What does your brain do? How does your brain adapt to that? Well, your brain can't just open a window to the outside world and say, oh, well, this is what it was, so I can check and balance here. Your brain is vulnerable to the inputs coming in. And so this is a really big aspect to concussions and brain injuries and just trauma in general, is the fact that inputs should kind of match outputs, or outputs should match inputs, right? That processing, that ability for the brain to respond appropriately is really key. And so those 3 friends really, kind of simplified, for lack of a better term. Friend number 1 is really your muscles and joints. So we talked about motor milestones for children, development, physical exercise. You are always fighting gravity, and gravity is actually your friend because it's always activating and stimulating your brain. This is one of the reasons why when astronauts go to space, they can't stay for very long. And if they do, they are exercising for 2, 3, 4 hours a day. They lose brain integrity based off of that lack of feedback. So muscles and joints are huge. Anyone's been in a car accident, who's had a concussion, the neck muscles, the cervical spine, the suboccipitals, all that stuff is relevant. Maybe it is even a low back that starts sending aberrant information into the brain. So friend number 2 is your eyes. And so what I mean by eyes and vision is, an optometrist is going to look at your eyeball and they're going to be able to tackle things that I can't, right? So issues with your cornea, problems with your lens, stuff like that. What I'm referring to is the retina and all the software to the back part of the brain that allows you to process information, allows you to react and respond and tie together, where if you see somebody coming at you, you can have an autonomic response where your pupils get big, blood flow changes, right? Heart rate goes up, and I can make a decision whether or not I want to run, fight, flee, or fight freeze, right? There's neurological properties of vision. And that comes back to some of the things I said earlier about genuinely just taking things for granted till you lose it, about keeping your eyes parked on a target, which is something you do for like 80% of your wakeful day. That can become an issue for people with a concussion. Let alone being able to visually track something, judging depth perception, hitting targets intentionally, using these visual reflexes. Those are the things that can become affected with concussions, and that's a really big aspect for a lot of people. And then this 3rd friend is this inner ear friend, which is a system that's relatively old. It's not that well developed. It's what fish use when they move their heads back and forth to drive digestion and spinal reflexes. It's a system, your inner ear system, that allows you to control your balance and stability. And we're learning a lot more about it. There are aspects of it that are involved in emotional health. There are aspects that are involved with structural stability. So, Kylie, if I have you standing with your eyes closed and your feet together, and I come up and I just give you a big nudge, way before your cortex and your higher level 3rd story of the brain even perceives something to be like, well, Dr. Reis, you're kind of a jerk, right? These postural reflexes will fire and stabilize your hips, your knees, your ankles, way before you're even consciously aware of it. So this inner ear system is a really important aspect to us, and that's dealing with things like, visual changes, vertigo, dizziness, kind of that brain fog disconnect. But all 3 of those friends are really important for brain function, and they have to go to the same party. They have to tell the brain the same story. Classically, what happens is those friends go to the same party and they tell your brain different stories after a concussion. We call it a sensory motor disconnect or dysfunction for the clinical term side of things, but patients come in saying, hey, I feel like I've got brain fog. I feel confused. I feel like I'm all over the place. Maybe I'm dropping stuff. My vision seems blurry and off. Maybe I'm going into a big box store and I feel overwhelmed, right? Those are the outcomes that we see from a symptom standpoint that give me clues as to what those three friends are actually doing.
That's an amazing analogy. So thank you for that. Okay, everybody, that's going to do it for another episode of Mind Matters, Navigating Head Injuries and Concussions. I really hope you've enjoyed our conversation. I'd invite you to come back for our next episode where we're going to pick things back up and kind of dig more into some things we've started talking about today. So remember, you've got to like and subscribe, hit that bell to receive notifications of our latest and greatest in content. And as always, remember, if you're in pain, call Shane at 980-999-9999.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.